Good morning. This is Kyra Hopkins. I'm going to do a PowerPoint on a head-to-toe assessment. First, I will knock on the patient's door, introduce myself, let the patient know I will be doing a head-to-toe assessment. Check to make sure I have the right patient. Next, I will check vital signs, get the height, the weight, and the BMI. Then I will start the assessment starting with the head. Make sure head is the same size with body. Check for abnormalities. Check the cranial nerve 7. Facial nerve check. Have the patient close and open eyes, smile, frown, blow out cheeks. Then I will palpate the head. Then I will palpate the temporal arteries. Test cranial nerve 5. Have the patient open mouth against resistance. Then I will palpate the sinuses, maxillary and frontal. Then inspect the eyes. Normal pupil should be 3 to 5 inches. Assess the cranial nerve 3, 4, and 6. Use the pen light. I will use a pen light to and have the patient follow the pen light, checking for involuntary shaking of the eyes, see if pupils dilate correctly, and they accommodate. Next, I will inspect the ears for drainage, redness, abnormalities. Ask if the patient has any pain, then palpate the ear. Next, I will palpate the mastoid process. Use the otoscope to inspect the tympanic membrane. Test cranial nerve 8. Close one ear, whisper in the other. Ask the patient to repeat what I said. Next, you move on to the nose. Look into the nose with the pen light. Check cranial nerve 1. Sense of smell. Have the patient close eyes. Put something in front of the patient. Ask them what they smell. Next is the mouth. Look at the lips for chapping, sores. Make sure they're the correct color. Check cranial nerve 12. Move mouth side to side. Look inside the mouth. Make sure it's pink. The tongue is moist. No lesions. Check the teeth. Check the urula. Test cranial nerve 9. Have the patient say "I," checking that the urula moves upwards. Check the gag reflex. Check cranial nerve 10. Then I will look at the neck. Look at the trachea. Test cranial nerve 11. That's the accessory nerve. Move head side to side, up and down. Shrug shoulders against resistance. Place the patient at a 45-degree angle. Have them turn to the side to check the jugular vein. Then palpate the trachea. Then I will palpate the lymph nodes. Then I will palpate the carotid artery. You do that individually. Doing them both at the same time could cause the patient to pass out. Then I will auscultate the carotid artery. Next, I will do the upper extremities, checking for lesions, swelling, any abnormalities. Palpate the pulse. Check the capillary refill. Squeeze the nail bed. Check the skin. Do range of motion of the hands. Palpate the brachial artery. Test muscle strength by having the patient squeeze fingers, push and pull with the arms. Check for a drift. Have the patient close eyes and hold out arms. That's checking for the drift. Next is the chest. I will check for abnormalities. Check the patient's laboral breathing. Check for the barrel chest. Listen to the heart and lung sounds. After I do that, you move to the abdomen. When you do the abdomen, it's inspect, auscultate, percuss, and then you palpate. Ask about bowel sounds. Ask about bowel movements and urination. Check abdominal contour. Check for masses. Listen for bowel sounds. Then listen for vascular sounds. Then I will palpate. Last is the lower extremities. You inspect the color of legs and toes, hair growth. Check for any swelling or redness. Check the pulse. Push the tibia. Palpate the feet and check pulse. Check capillary refills on the toes. Have the patient push against hand and push against resistant. Check reflexes. And last but not least, you would inspect the back. If the patient is not mobile, you make sure there's not any redness on the back. And that will be the end of my head to toe assessment.